Hi, this is Silent Cheers from King's Academy. Here we are doing an OET role play for medicine, and this is Dr. Elizabeth. How are you?
Hello, sir. I'm doing great.
Thanks. So we're going to have a OET role play for medicine, and you know that the two role play setups, and each begins with 3 minutes preparation time, right? And before proceeding further, I would like to ask you some basic warm-up question. Okay? Right. Could you please tell me your full name?
I'm Elizabeth Abraham Marrett.
That's right. And where do you come from?
I come from Iriti. It's a small town in Kannur district, Kerala.
That's right. How long have you been working as a doctor?
To be frank, I have just completed my MBBS and I'm waiting for my internship to take into place.
That's right. Would you mind if I ask you, have you been inspired by any person before coming to this field of medicine?
To be frank, I don't have any such kind of role model or a doctor as a role model.
Yeah.
But when I was young, when I was a child, I have seen many people coming to my grandfather. My grandfather was a social worker for money for the treatment.
Okay.
So that is the reason why I wanted to be a doctor, because I feel like when I was a child, I felt like I can help people if I become a doctor, and I can help them in healing their diseases.
That's right. Well, where would you like to work as a doctor, in your home country or in a foreign country, and why?
Actually, I would love to work in UK. I would love to do my specialization in UK because there are more opportunities when we are doing PG in UK. So I'm looking forward to that.
So in that case, in which field would you like to do your specialization?
I would love to do in cardiology. Because that was my childhood dream, to be a cardiologist.
Very good. Indeed, Dr. Elizabeth. So we're going to start with our first role play. So this is your first role play, and you have some time to look at questions, and you can make some short notes if you want. And if you have any doubts, you can ask me. Okay? Good.
Excuse me, sir, how may I address the patient?
Peter.
Okay, thank you.
Okay, Ms. Elizabeth, are you ready?
Yes.
Shall we start?
Yeah.
All right, you may start now.
Hello, good morning, Mr. Peter. Just to remind you, I'm Dr. Elizabeth. How are you doing today?
Hi, doctor. Good morning. Okay.
Okay, that's great. So I'm here to inform you happy news. You are ready for the discharge. So are you excited?
Well, I don't think I'm still back to normal. Are you sure of that?
Yes, Mr. Peter. Is there any specific concern for you to think like that?
Well, nothing like that specifically. I don't think I feel quite normal. But if you say that, I'm okay.
Okay, Mr. Peter, your concerns are reasonable. I would like to inform you that your pneumonia has been treated by intravenous antibiotics, and all your blood tests and vital signs are normal. So there is nothing to be alarmed of at this moment. And you can be discharged and you can go home, and you can take antibiotics orally for 3 days.
Okay.
So do you have any other concerns in between, Mr. Peter?
Well, the problem is that I live with my partner and I have 2 teenage children, and it's a bit hard for me lately, and I work in a busy retail job. Do you think I will require more time off work?
Okay, Mr. Peter, I understand it's really worrying for you. Okay, so it's really necessary for you to take a week off from work. And before going further into details, would you please tell me that whether you have any tougher situation in your work area and in your home?
Well, there's nothing difficult for me, but my finance condition isn't that great recently, so I can't take more leaves. That's the real problem. Do you think I have to take lots of rest at home?
Okay, Mr. Peter, at this point I understand your concern, but I would like to inform you that it's highly recommended for you to take 1 week off from the work and to not be alarmed by about the financial problems. I can give you a medical certificate, so it can help you to take a week off from the work.
Okay.
So, do you have any other concerns in between, Mr. Peter?
Well, thank you for your medical certificate, but I just wonder, should I do anything when I am home?
Yes, Mr. Peter, always coming to that, I would like to inform you that you should concentrate on your medications, and also you should come back to the hospital if you are feeling any kind of worrying symptoms like chest pain, acute shortness of breath or high fever. And if you are not feeling better, you can come back to hospital in 1 week.
Yes, I understand. But again, if I want to come back, I think I need to take time off again, right, from my work.
Yes, Mr. Peter, but don't worry about that. Our working hours are flexible, so that you can come after your duty. So the doctors will be here to help you. And before that, I would like to remind you that you should come back to the hospital after 6 weeks for a chest X-ray, because we need to monitor your present condition and need to know that whether there is any underlying disease for your possible conditions. Is that acceptable to you, Mr. Peter?
Yes, but that's my problem, doctor. If I have to come back again for the chest X-ray, I think I should apply for the leave again. I think that will affect my work.
Okay, Mr. Peter, I can really acknowledge your concern, but do not worry, Mr. Peter. As I have mentioned to you before, our working hours are flexible. So if you are not able to take off from the work, you can come after your work. So I can arrange you with that, and nothing to be alarmed of at this point. So do you have any other concerns in between?
Yeah, that sounds great. I think I will take rest for a week, and I will see if anything wrong, and I will let you know.
Okay, Mr. Peter, I appreciate you on that. And to conclude, I would love to remind you that you have to take antibiotics for 3 days, and you can come to hospital if you are having any kind of serious symptoms. And also, I would like to remind you that you should come back to hospital in 6 weeks to take an X-ray, so that we can check whether there is any underlying disease in your case like cancer. But please don't be alarmed by hearing that word. It is just a possibility, and we can do further tests and we'll know whether there is any underlying diseases. So is that clear to you, Mr. Peter?
Yes, doctor, I understand.
Okay, Mr. Peter. So if it is acceptable to you, I can book an appointment for your X-ray after 6 weeks.
Yes.
And thanks for coming to see me, and I wish you a speedy recovery.
Thank you very much, doctor. I appreciate you.
Okay, Mr. Thank you.
Good. That's right. So that is the end of our first role play. All right. So this is our second role play setup, Miss Elizabeth. So again, it's an emergency department setup, and I'm going to be a parent of a child, and you're going to be the doctor in the emergency department.